And we are live. Hello, Sarah White. Thank you so much for joining us. You are the CEO of Jean Hales, which is a foundation for women, a charity in Australia that really helps all aspects of women's health, including menopause. And we are talking about probably some of the most important things that are going on in the menopause world at the moment, in terms of, apart from the lack of research, but in terms of the information that we get, medical misinformation, menno washing, and how we actually make sense of all of this. And what a few years it's been. That's all I could say, really. I just look back at how this started, or not started, because it's obviously menopause has been around forever, but how we have changed over the last decade, really, in the kind of messaging that women are being sent across absolutely every aspect, not just, I mean, I don't know whether you saw this morning. I will stop talking in a second, but I don't know whether you saw this morning. There was a skit that came out of America that was sort of the Maha Hospital, and it was looking at all of the kind of medicine stuff we're getting from there, but now it has spread really into what we would necessarily call our bread and butter, women's health. So I mean, beyond anti-vax, beyond anti-Tylenol, beyond all of these kinds of things, we have the anti-abortion, we have the anti-pill, and we have a whole bunch of medical misinformation that seems to be confusing women in menopause. So let me throw the big one at you straight out. How the hell did we get here, and how do we get out?
Gee, thanks, Fiona. How the hell did we get here? Well, I think we got here because there's a whole bunch of things, and I'm listing them, but they're not in priority order. It's all these things coming together. So we've got changing media patterns. So we now have this democratization of sharing stories on social media. It's really easy to share your story. We didn't have that way of mass broadcasting personal stories and personal opinions, which has been really great in some respects. It's helped women break the taboos. It's helped women find support. It's helped women find information. But the algorithms that sit behind these social media platforms do tend to promote those stories get the most responses. So it does, in the end, promote those things that are, controversial or highly emotive. So that's one aspect. I think we've also seen that generational shift. So, Gen Z, Gen X rather, that's me, I should know my own. We're not sitting in silence kind of thing. We're a bit more bolshy, and we're much more in the workforce. We're much more likely to be in senior positions compared to, like, say, my mother's generation. So I think there's that much more interest around things that might be affecting me personally, and so I'm going to talk about them. So we've got the channel, we've got the people wanting to talk. And then, I think this lack of knowledge about women's health is where it has finally caught up to us at a societal level. So women are saying, okay, I've got this problem. I'll go to the usual channels to find out the information I want, and it's not there. So there's this sort of feeling of a real gap in good information that's available. And then we add to that commercial players. And I think these are really, really important, because the commercial industries around the world have woken up to the fact that these Gen X in the workforce, disposable income, looking to, make sure they live long, healthy lives, have money in their pockets because they're employed, and by and large have money in their pockets. And so they are saying, oh, look, here's a moment, not to put a fine point on it, to cash in. And some are doing it very deliberately and in a very predatory way, and others, I think, are motivated by genuine, I think we can help here. But what happens is, when you're marketing something, you really don't want to say, look, for most people, this process or this condition is fine. Only a very small people will be severely affected, and so only that very small people will want to use my services. So marketing of any product tends to sell the disease, sell the ill to sell the pill. Is a line I read not long ago. So there's a lot of that marketing is playing into presenting the menopause transition as a universally terrible thing that really knocks women around, women have all this stuff going on in their lives. They're like, oh, that must be it. Oh, and look, there's a solution. And every story I hear from women is exactly the same thing. So it's a whole, how we got here is a really big question because there's so much playing into it. How we get out of it is going to require a whole other very large effort.
Absolutely. Over at your neck of the woods, Samantha Thomas, who you recommended to me for my beautiful product placement book there, she's done some very good research looking at exactly this. And as you mentioned there, the catastrophizing of a situation, basically painting it as something that, unless we have outside help, we're not going to be able to get through. And she also pointed out a couple of other things that they've done very well. And I remember a few years back, actually, Ray Moynihan did some investigative work on the marketing that pharma companies were doing behind the scenes of various diseases and things like that to plug or to grow their sales. And it looks like in many ways these have been those tactics have been taken across from one market to the next. And plus, I guess this benefits the pharma companies who make HRT. The other things that she was mentioning in there are this I'm listening, becoming your friend. The join our community. We're here for you. You've been ignored for so long. But in that kind of messaging, it seems to have actually gone a little bit further to really undermine trust in the system as well. What your doctor's not telling you, what they don't want you to know. How damaging is that?
Extraordinarily damaging. Extraordinarily. So let me step back just a little bit. So before I was the CEO of Jean Hales, I was the head of a program called QUIT, which is the most comprehensive tobacco control program in Australia. And so what we looked at a lot are these commercial determinants, how companies, at the time it was cigarette companies, tobacco companies, but also vaping companies, how they manipulate people through grassroots. We've got you, no one else sees you, the professionals aren't telling you the truth, here's how to save yourself. And when I came across to women's health, I looked at what was happening in the menopause space and thought, oh my goodness, this is exactly what I used to see in tobacco control. The tactics being used by some of these marketers and influencers was exactly the same as what we'd seen in the vaping, particularly groups. And that's how Samantha Thomas became involved, because I contacted her and I said, Sam, I'm seeing exactly the same tactics here in women's health. So that's where she started looking. The parallels were so uncanny. So there's that. And I've completely lost my train of thought on the last question you had.
Don't worry, we've got a supplement for that.
At 5 a.m, one of the two. Yeah.
Sorry.
No, not at all. So I think there's real parallels there. And then what Sam has shown and what we instinctively see, or what we see when we look around the platforms, is, yes, come to me. I'm the only one who's telling you the truth. And that erosion of trust we are seeing all the time. So Jean Hales also has a specialist women's health clinic in Melbourne in Australia. We've been running for 30 plus years. It came straight out of Dr. Jean Hales' work, who set up the first menopause clinic in Australia. It was only the second in the world. So for continuously going, if you like, some of the clinicians, one of the clinicians in our lab has been in our clinic has been on this for 40 plus years. And so she has got people coming in saying, well, I don't know that what you're telling me is quite right. What about this? What about this? And our clinicians across Australia are saying they spend, 10, 15 minutes of precious consult time having to debunk, if you like, or explain some of the things that are coming in. And I'm a big proponent for doctors should be explaining things better and explaining things more. But when women are coming in from a basis of, I'm not sure I can trust what you're telling me because I've been told online I can't trust what you're telling me, that's deeply, deeply damaging.
Yeah, in what ways though? Because people say, oh, well, we don't trust big pharma, we don't trust other people. What kind of real damage can it do, say, in terms of, if we're talking about the establishment of new guidelines or other kinds of the rule settings? Because I guess what we've seen then is a lot of people saying, you're wrong, because you're just not up to date. You haven't been keeping up. The
Mm.
ivory tower has been sitting there, completely ignoring you, and they're just not up to date with what's happening. So that kind of distrust, does that then spread into the very fabric of how we actually take evidence out and give it to people to make sure they're getting the best care?
Totally. And we're talking about menopause, but Gene House, we look at more than just menopause. So we're also looking across the declining rates in the use of hormonal oral contraceptive pill and the rising rate of unintended pregnancies as a result. We're looking across the world at vaccine refusal is getting more and more entrenched. We're seeing women in the birthing suite refusing the doctors to give their babies vitamin K injections or Hep B. We're seeing oncology treatments being refused. If you look at the Edelman Trust and Health report, and I recommend anyone can go and look it up. So that's the 2025 Trust and Health report from Edelman, which is a big PR company. It's a pretty short report, but it shows some really, really concerning things. Like I can't remember the exact numbers off the top of my head, but it's almost like 1 in 3 people have ignored medical advice in favour of what they've been told by friends or family. Trust in governments, trust in establishment is increasing.
Sorry, that's my dog. Betty, go. No, go to your room. Go. Go. Go on.
He's obviously very disappointed at the rising mistrust as well. So worldwide, we're seeing this lack of trust in the mainstream legacy media. People are far more likely. This is one stat. If you've got how do you judge the why you would listen to the expert in front of you? 72% of people will look at their qualifications. 69% will say, no, it's more important they've got lived experience. So yes, we're talking about menopause, and there are some things that are unique to menopause. But across the world, we're seeing this mistrust. And if you want to go and see something really horrific, go and look up the Facebook groups of people who are using bloodroot salve or black salve to treat their skin cancers. And the ulcerated lesions, as someone who's worked in cancer research before, and cancer hospitals before, I look at this and they're all advising each other about what to use. And I'm watching these people with just these cancers just ulcerating because they're putting on black salve instead of going to their doctors.
I don't even know what black salve is, and I don't think that I really want to. That just sounds horrendous.
Horrendous. Yeah, and this is, so I think this is a societal piece, and we're definitely seeing some of the influencers leaning into this, deliberately or not, or just because they want to drive the algorithm. You can't trust the doctors to tell you what's happening to get their attention, right? They want controversy to drive the algorithm to get attention. But what they're doing is really playing into this erosion of trust in medicine and science.
Yeah, absolutely. The interesting thing out of that, though, is we ran a little study the other day literally 50 people answered it, but basically it was showing, asking people what hormone supplements they used for their menopause symptoms. And most of them were taking stuff for either sleep, for joint pain, for vasomotor symptoms, and for mood. And 60% of them said that they didn't think that they worked. And 79% of them said that they thought that it was predatory, that they were actually being preyed upon, but yet they were still spending somewhere between 20 and 50 pounds a month on the supplement. So there seems to be this disordinate trust of the supplement manufacturers, but not of the people who do have the evidence behind them that the products that they're producing are actually going to make a difference, especially for things like cancer and those kinds of things. How have they managed to pull that off?
I think they're selling hope. I think they're selling easily accessible products that might just work. So I'm a bit desperate here, so I'll give it a go. I think, we're looking at this. There's also this very sort of individualistic approach to health now, where I've got to try and fix myself before I go and see someone else. And it's really easy to walk into the pharmacy and go, oh, they've got something on the, oh, that might help, and it's £20 and I'll give it a go, rather than I've got to make an appointment with the doctor, I've got to get to the doctor, I've got to pay more to see the doctor. But it's a kind of false economy, because so many of these products don't work. You would have just been better off going to see the doctor in the first place. And Fiona, one of the things that I think we also need to try and raise in our sort of when we're talking about these things with patients, with community, we've got this big pharma, right? But actually, pharmaceutical industry is quite tightly regulated in terms of what they can say and what they can do. Very regulated, sort of tightly regulated. Back to compared to what they used to be years ago, yes, problematic. Now, pretty tightly regulated. But big wellness is growing faster. They have no regulations on what they say, no regulations on what they do. And if you want to see, like, there's apart from Menopause covers menopause, and it's fabulous, I love it. There's a new book out called Bad Influence by Deborah Cohen, and that really lays out some of the sort of these wellness tactics of using influencers and using what look like grassroots community people to tout products and at-home tests and screens. It's really, really interesting book. So I think big wellness is something we should be far more pointing a finger at in the menopause space than we should big pharma.
Yeah, absolutely. As a little aside to that, I was not a huge fan of this documentary that was aired the other night by Louis Theroux here, looking at the whole sort of rise of the manosphere. Yeah, and actually, I having come from a documentary making background, I thought that it could have been done a lot better, and the trail of the money should have been chased, all of these sorts of things. Yeah. But in terms of just the fact of showing that these are on the other side of the thing, were literally people who A, didn't really particularly believe in what they were saying, and B, were making a buck out of every time they recommended something. You have to really wonder about what's happening on the other side as well. And this sort of advertising
Instagram pays. If you're an influencer on Instagram, that's Instagram's term for them, and you have a certain number of following, your posts are automatically making money. So if you look at the top 4 influencers on Instagram for menopause, they're all doctors. They're all at least selling a book, and the top 3 are selling more than just books, and they'll be making several $1,000s on posts alone, even if they're not touting something.
Damn it, I'm at the wrong end of the scale, aren't I? I'm not making any money on my posts.
Unfortunately, though, unless you're prepared to say things that are slightly controversial or believe me, I believe you, no one else believes you, but I believe you. Yeah, that's how you get people following you and sticking to you.
I know, and that's a problem. Unfortunately, I'm the most boring person on earth. And that's
I might be second most.
Nobody likes the boring stuff. The lived experience is an interesting one as well, because you would actually think that most of the people who have gone through, many of the people who work in the menopause space are women, and most of them probably would have lived experience themselves. So why is their lived experience not counted?
Well, I think the problem is data. So, anecdotes versus data. I think we can learn a lot from lived experience, but we need to be really careful to not think that one person's lived experience is necessarily the truth for everybody. Okay, perception's reality. We all know that. My perception of something is my reality. So my lived experience of menopause is very different to your lived experience of menopause. So who's right? Neither of us are right. Both of our experiences are valid. People will learn something if they say, well, my experience was like Fiona's, I'm going to learn from hers. But someone else might say, well, actually mine was like Sarah's, so I learned from hers. I think the problem is when groups of people with similar experiences get together and say, and they're not intending to do anything wrong here. They're getting together, yeah, that was the same as me. That's the same as me. And there's a great community building in that and a great sense of not being lonely in that. But the danger is we all have cognitive biases. If you're human, you've got cognitive biases and you don't even know that you have them. I have them. We all have them. So when you start going, well, I've had the same as her and who's had the same as her, so this must be the universal experience. So everybody else has this experience. And I see some advocates, not just in menopause, again, in different, I used to head up the community advisory committee at a major hospital here in Australia, and women's hospital. And I often saw advocates falling into the trap of believing their experience was a universal experience. And I think we all just have to be really careful about that. That's why we need to do carefully designed trials that take out some of our cognitive biases, and take out some of those things that influence how we see and experience, so that we can get to a more universal piece for everybody. That makes sense?
Yeah, absolutely. Yeah, it certainly does. One of the places where people are often, these men, you mentioned their communities, and how important is it then when we're doing that? Because there are so many of them, and some of them are huge. And sometimes I try not to go into them now because they just they upset me, to tell you the truth. Moderation. If you're going to have these groups, I mean, coming from a broadcasting background, I know that I'm responsible for whatever I broadcast, and therefore, if I have a community group and I'm publishing in that, and I'm allowing other people to publish in that, I'm actually responsible for it. However, we see it a lot in a lot of these groups that it is literally a free for all of everybody giving their opinion, and you don't know whether that opinion is coming from somebody who's actually trying to sell you a product or not. They might have ticked the box in the joining group saying, of course I'm not selling you something, but they may well have. Who's doing the due diligence? How do we make sure then that because this is where a lot of people go for information, how do we make sure that should there be some sort of form of regulation? I'll come to regulation on claims in a minute, but some sort of form of regulation on people who are hosting communities, to make sure that the content they have in them is evidence-based and correct.
Well, technically they should. So if you're hosting a forum, say here in Australia, and you're making medical claims, then technically you're potentially in breach of the Therapeutic Goods Administration's Advertising Act. So technically, yes, you're responsible for what's on your page. In reality, no one's looking, no one's, monitoring these things. And I don't think we're going to be able to solve this until some of the platforms get serious about misinformation and combating that. Like, Facebook used to be a really good place to actually share information and get really good information. It is completely overrun now with bot farms, with misinformation. Meta quite deliberately and quite, openly stepped back from fact checking. And it's just, I wouldn't even call it the Wild West. It's something 10 paces down from the Wild West. It's an absolute nightmare in terms of health information. And again, we're looking across, we do social listening at Gene Hales. So we're listening to things that happen on the internet and what people are worried about, what they want to know, what their concerns are. And some of the things that are coming back are just ghastly. Again, around the contraceptive pill, for example, the lack of just sheer misinformation and disinformation on that is terrible. And one can't help but wonder whether this is actually malinformation, where it's political actors who are actually trying to control women in terms of their messaging around contraception. Particularly, it's just, I washed my sheets in Tide and that's why I had a miscarriage. So miscarriage myths is huge. 1 in 3 young Australian women believe the past use of contraception causes miscarriage. So the misinformation that's out there, that's driving.
They also believe that the sperm of a previous partner is going to oh my God.
Yeah, that's taken off in the bloke side of thing. I'm not sure that the women I haven't seen evidence of the women believing that piece of rubbish, but it's there should be some sort of checks and balances. You have the right to your opinion, you have the right to say what you want, but you don't have the right to broadcast it as if it's a piece of truth. And that's what's happening. And I think we need the platforms to do something there. She says, throwing up her hands in. Like, it's not going to happen, right? Because
no, I guess
content
it won't. Very
drives eyes on advertising.
Yes, that's true. And which leads me straight into ads then, because this is the other thing too, when we've got, when we've got the person with the lived experience who's coming on and saying, you know what, my menopause was awful. It was absolutely dreadful. I could barely live through it. I couldn't concentrate. I couldn't do anything. I couldn't do this until I tried this. And it was great. It changed my life. It was absolutely wonderful. Now, most of the time, you don't know they are supposed to, in theory, put a sign on it saying, hashtag ad,
Yep.
or if it's gifted or any of those sorts of things. All those things are sort of supposed to be said out loud and shown, but there's no enforcement of that either.
No.
How do we get around that? Because you just don't know whether or not they're telling you the truth, or whether they're not, unless people are forced to, like with the pharmaceutical industry. If you're a doctor, you're supposed to actually say, yes, it goes onto a register. We have paid this person this amount of money. Do we need a similar sort of thing for people who are selling supplements, or whatever, to provide the information on who they gift to, who they pay to?
Well, I think we do. The problem, though, is supplements come under a food sort of category of regulation, if you like, when you look at drugs and medicines. So that comes under foods, and there are different standards in terms of the claims they can make, the advertising they can use. That's what I mean. I think big wellness is far more dangerous than big pharma, because there's zero regulations. So I think, yes, we should be demanding that happen, or asking for that to happen. That requires changing, our food and drug laws in each country, as I understand it. It certainly does in Australia. The other thing I think we need to do is we need to actually, I hate to say, I sound like I'm 80 when I say this, but we need to teach media literacy and critical thinking in our schools. Because again, we really need, most women, look at Sam Thomas's study, most women know that the marketing's predatory. They say that other women are falling for it. But when you again look at this Edelman Trust report, most people believe that they can differentiate between good claims and bad claims. I would suggest that's probably the Dunning-Kruger effect in motion. So there's another bias. People who don't know much think they overestimate their knowledge. And so I think that we need to do more in teaching people about media literacy and that digital literacy sort of thing. Why are people saying these things? This could be the motivation. How do you check this information? There's a whole piece of work that some of the social scientists are really looking at now around how do we actually teach people to assess information in a much better way, so that they can look at someone going, oh, look, I took this, and immediately say, well, okay, if you've got a product that you're touting, I'm immediately a little bit suspicious, and I'm going to really check that hard.
Yeah, absolutely. Regulations you have mentioned, and then it comes down to the claims that people make as well. Now, this is a really, really big one, because there are times literally when I just almost fall off my chair when I open up my social media. I'm looking at going,
Yes.
Really? You're going to say that? But again, there are bodies here that are supposed to pick up on these, and we can report to them. I've reported a number of things over the years, and I've got to say, I think I probably had 2 replies from them. I don't know where they go. Does there need to be, given that now, as you're saying, that this is a big sphere, the wellness sphere, does there need to be more money put into this? Because it's not just that it's benign. I mean, you can take some of these things and they can actually do some serious damage.
Yes.
Some of them, they can do liver damage. Some of them interact with other medications.
Yep.
Does there need to be much better regulation then, or more money put into policing it, and also making it very, very clear that it's not necessarily always benign? And also, we just don't even know where half of them are made or what's actually in them.
Yeah, they could be being mixed in a bucket in the backyard for all you know.
Yeah.
Look, yes. I think there does need to be more money put into regulation. I think the challenge is our regulators are always going to be playing catch up. They're always going to be playing whack-a-mole to a certain extent, and it may be better to actually just, this whole commercial solutions, commercial determinants of health. They're going to be constantly innovating, because that's all they're doing to keep their eyeballs, whereas the regulators are having to try to come in behind and say, what are they doing now? Let's now try and close that loophole. It takes a long time to do these things. And unfortunately, I do think, and I have some sympathy with this one too, our regulators are doing things like assessing the quality and safety of drugs to cure a type of cancer, or to treat this terrible respiratory illness, which is really at that pointy end of saving lives and improving quality of health. And where in this bubble around menopause is really super important. And we look at these women who are wasting money on making their urine really expensive and not going to get the help that they might need. and we're really concerned about them. But actually, there's a whole bunch of other things that our regulators are doing really, really well and really important work, preventing another thalidomide, all that sort of stuff. So in terms of where you put those precious dollars and that precious energy and effort, I think I understand why they're prioritizing up some other things. I think we're going to have to actually ourselves, and when I say ourselves, I mean regular women, people who are involved in menopause education and research, as we both are, doctors, pharmacists. Come back to pharmacists. I think we all need to be putting a safety net around knowledge and just raising awareness of some of these big issues that are potentially helping women, because I think the regulators are too busy on other really important things and too slow to catch up with where the commercial players are innovating.
Yeah, it's a shame, really, isn't it? It's interesting actually with pharmacies as well. We're about to run a course for pharmacists that is going to look at, as well as one of the components on it, of what things that they're selling off the counter actually have evidence behind them, which is going to be a pretty small list. But I think the difficulty is here. I mean, they again are private businesses, and this is one of the things that that Sam found in her. No, it wasn't actually Sam, Mary McCartney in her study. Look at all of the information online. That, in fact, actually, I've been looked down when I hear them. Is that 77% of the claims that they looked at online came from people with conflicts of interest, which included private practice, or they had pharmacy funding, or they had retail products that they were trying to sell. But chemists are also private businesses, or the vast majority of them. So, in many ways, it's in their interest to say, yeah, take your HRT and all of these other sorts of things, but this will help as well. You'll need your magnesium for your sleep, and you'll need your whatever else it is, on top of these. And so, you walk out literally with a bucket load of stuff. So that's a tough one.
Which is why I think it's really important that we increase that literacy in the community around, if someone's got something to sell, even your trusted pharmacist. Now, I'm a big fan of pharmacists. I think they can be really great places for information. But there is a tension, and full disclosure, we've worked with a pharmacy chain over in Australia called Priceline. We've developed some online training for their pharmacists to be able to give evidence-based information and advice. And I'll stand behind that, because I think they're a great place to get information and advice. But we thought so long and hard about it, because the pharmacies also do sell, St. John's wort and all these other sort of bits and pieces. And some of those products can be helpful. If you have a mild issue, you go and try something. For some people, they can be really helpful. But there is a real tension where anyone is selling what they're advising. There is an inherent conflict of interest. And so I think we've got to be really careful with pharmacies. I think there's that inherent tension between, I'm just not going to advise you do something if I don't actually sell it, is a bar for them to get over.
Yeah, it's a difficult one. It really is. It's a very, very difficult one. Say hello to my husband.
Hello, hubby.
Yes. It was interesting too, her study, because it looked at the people who were making the claims. And so basically it looked at 180 claims on different platforms across social media, and looked at basically how they differed from what the guidelines actually said. And it found that of the complaints that actually basically 57% of them didn't match, and actually it was even more than that. Sorry, 67%.
67.
Yeah, it was 67% of them were outside recommendations, and 53% of those claims that were made outside of medical representations or outside of guidelines that came from medical professionals, which is a little bit scary.
Yes. Yeah.
Yes.
But I think there's some medical professionals out there who are monetizing the attention economy. So it doesn't, I'm not going to go and follow someone if I've got, concerns about whether my doctor's telling me the right thing. I'm not going to go and follow someone who says, yeah, follow those guidelines. that your doctor told you about. And, going back to what's the impact, one of the doctors in the Jean Hales clinics was telling me the other day, now we've got privately billed clinics, so they're reasonably expensive. And she went through this big hour-long, session with this lady who travelled from the country to go and see, this specialist about menopause. And our doctor got to the end of it and said, right, this is the treatment course. This is what I'd like you to do, da-da-da-da. And the woman sat there and said, oh, that's exactly what my doctor said too. So, but if you're following online when someone says, no, your doctor's probably not telling you, and you're not going to follow someone who's saying, here's what you should be doing. This is what all the guidelines say. This is what the evidence says. You're looking for something different. You're looking for the nugget, that the special stuff that, you think is out there because you've been told there's something out there. So these influencers are selling products. They're selling weighted vests, books, their own clinics, their own formularies, and they have to tell people that they've got the secret sauce, because otherwise why would you follow them if they don't have the special secret knowledge that no one else has?
Yeah, it's a bit scary. So how do people then differentiate between who is selling the secret sauce and the people who are actually giving the right information, as boring as it may be?
Yeah, well, I mean, again, I think this goes back to the critical thinking and the media literacy. Being working in prevention for a long time, if we could get our diets right, physical activity right, sleep right, those 5 pillars of health: connection, mental health, and well-being, we would solve so many of the health issues that are out there and health concerns that are out there, and including doing a lot to help with women who are really struggling with menopausal symptoms, because if you don't optimize some of these other things, all the best MH or HRT in the world is not going to, work to its best, right? But the problem is it's not sexy. It's not a pill. It's a daily choice to do something that's, not the couch. And, I say this knowing that I don't always do it either. It's when we want a fast solution. We're busy. We've got so much stuff on our minds. We want that fast solution. We want the magic pill, and doing the work around getting our partners to take on some of the load, getting, our work sorted out, getting outside for our 20 minutes of walking, doing our resistance training, making sure we're eating enough protein and vegetables and following a Mediterranean diet. It's really hard. We're looking for something that's, fast, easy. And so when someone sells a magic pill, we go, oh, that's what I'll just pop to the chemist and I'll just pick up that tea that's going to solve all my problems, and then I'm done. And then I can get on with sorting out mum and sorting out the kids. And, so it's really, really hard for women at midlife, not necessarily because of menopause, because of everything else. So when someone says there's a secret sauce, we immediately latch onto it. We have to actually, as a society, go, do you know what? There is no secret sauce. There is no magic pill. We just actually have to put time into doing some of the basics. And it's not a sexy message. It's a boring message. That's why nobody will follow me online.
I feel your pain. It is a boring message. The other thing, though, it's sort of gone beyond supplements as well, and into let's have a little look at the femtech industry, which I love on many respects. But then there are other sides of it where I kind of think, I feel like my social media feed is being constantly overrun now by, I need to get I always pronounce this very, very badly. In fact, I'm just going to use the initials because I know I'm going to stuff it up. Anti-malarial, the
anti-malarial hormone, AMH.
Thank you very much. Yep. Yeah, for fertility when it's not. It's not a fertility test. I've got to get a pre-menopause blood test. I've got to get a post-menopause blood test. I've got to buy all of these kits online, prick my finger, send the blood in, so I can get a result that once I take to my GP, they're not going to accept anyway. But we're kind of being told that if we don't, this is going to be the thing that's going to tip us over, and then our GP will give us absolutely everything that we want because we brought this test in. How many of these types of things actually have any evidence behind them?
Few, very few. That's the simple answer. Very few. And again, I'd urge you to go to Bad Influence. Deborah Cohn does cover this, some of these home tests, personal MRI tests, MRIs rather. So look, there's a lot of stuff out there, but again, literacy. If someone is saying to me, oh, you need this, if you don't have this, it's going to be a real problem. Well, why the urgency? You're not the only person in the whole world. You're the person who's come up with that solution, have you? And you just happen to have a test, red flag, red flag, red flag, close the browser, walk away. It's really, this is predatory marketing at its finest.
Yeah, and actually mentioning the breasts, I hadn't heard this one myself actually until today, but telling people that they're dense breasts means that they have to have an MRI and an ultrasound and have annual mammograms, which is, wow, who's selling those? I mean, an MRI is not cheap.
No, and some of these tests are really, they're dangerous. So you get the worried well. Something shows up on a test doesn't necessarily mean it was ever anything to worry about. And I remember being told, I don't know if this is true or not, but being told by a clinician once that pretty much every elderly man who dies has a prostate cancer when they die. It's not doing anything. It's not why they died. But if you go looking for things, yeah, you'll probably find things. But what it then leads to is a barrage of additional tests, additional risks. It's not necessarily, and that's why screening programs are set up to catch the things that we can actually do something about. So yeah, look, it's, again, bad influence covers this really well. It's a really tricky space to dive into this whole, you can be too proactive about looking for things in your body. You end up really stressed about it. You end up doing more and more screening because you're not sure. If I've got a screening test that says you've got a problem and another one that the doctor's done that says you don't, who do you believe now? So you do more and you do more and you do more. And it's a really tricky space to try and analyze, because not many of these tests have great evidence behind them, and certainly not to use as a diagnostic tool when you really don't need it.
Yeah, it's interesting because then you'll get the you'll see the celebrity popping up going, I was given this MRI and found my thyroid cancer or whatever. Yeah. And so then everybody thinks, oh my God, I've got to go and have one.
Yeah. And that anxiety can be very real. Oh, something happened to, my dad. What maybe I should go and do all that testing sort of thing as well. And I think sometimes it can really heighten that health anxiety, which really is not helpful.
Yeah, absolutely. You know what I'd really like to see in terms of turning this around, and this is my really big bugbear because I just can't stand it any longer, is paywalls on information. If we didn't have all of these paywalls on every newspaper, on everything, like you'll see this great headline, because often newspapers actually do things that are quite good, and sometimes they can actually really be quite balanced. And if we had more health information that was actually available without having to subscribe to everything every time you opened it, there are plenty of ways that newspapers and media organizations can make money now beyond subscription. They can monetize with Google, they can monetize with Taboola, they can monetize with Outbrain, they can monetize 1,000,001 ways with native advertising. There are so many ways that they can make money, which would actually allow them to have more readers accessing really good information. And the two areas where I think it's absolutely imperative are political information and health information, because they're the ones where we've got, as you mentioned before, the vested interests who are behind, telling everybody that the pill's bad for them and all of those kinds of things. There are so many vested interests there that are on social media that are completely unregulated, that are really changing the way we think. They're undermining democracy, and they're undermining that trust in the health system. We absolutely have to have free press. And by free, I don't necessarily mean that they actually have to be free like a public broadcaster to say what they say, or that they have to be, but freely available so you can actually read it without having to pay every time you open something up.
As long as they're not falling into the clickbait as well. So I've seen there's a couple of publications where, the sub-editors have got onto the headline and it's suddenly very clickbaity, and you actually then read the story and go, that's not at all, So yes, I think that, but there are some really, really good science, medical health reporters out there who do really, really good stuff. I know in Australia we've got half a dozen, I think now, who are just really good. public, radio, I think has been really good for getting out good information, because we don't have paywalls on that, and we can really explore things in depth. But actually, I think we need a whole of system approach. And just this morning has landed this big report on women's health misinformation, would you believe? Just came out overnight. So highly recommend that. Without it, I've just skimmed it. And it's, one of the people involved is Tina Pernat from Harvard University, who's just a star when it comes to this misinformation. I really recommend people look her up as well.
What's the report called?
So the report is, I think it's health information, a major issue for women's health or something, misinformation. It's just landed from the Women's Health Collective, which is actually in French. So Femme Santé Collective, and apologies for the butchering of the French. It's an 88-page report, landed overnight. There's a webinar coming up. I've just skimmed it and it's really terrific. And just having read a lot of what Tina Pernat writes as well, we need a whole of system approach to misinformation in health. We need to make sure that our clinicians are taking the time to explain what's being seen on social media, not debunking. Debunking doesn't work, but listening with empathy, trying to understand the real concerns, and then using the truth sandwich. Vaccines are safe. I know that some people believe that there's a link to autism. There is no evidence of this. We know now that they are very safe. So there's techniques. We need the clinicians to be doing that. We need not-for-profits, people like you, people like me, actually just calmly putting the right information out there, not attacking people who are spouting misinformation, because that just doesn't work. And then we also need our community spaces to actually be calling out misinformation and sharing good information. And that goes back to that literacy thing again. How do we know what it is? But we can't there's no way that any one of us can play whack-a-mole online and have people believe it, because people come to feel that this misinformation is actually part of their identity, right? So you're challenging their identity. So another good person doing work in this space is a guy called Matthew Facciani in the States, who's looking at social identity tied up with not just my health beliefs, but my religious and political beliefs. They're all being bundled together, and you can see this playing out online. If you look at the vaccines, there's this real political and religious piece wrapped around it as well. So challenging just the health misinformation can be challenging the person and their deeply held personal beliefs. So we've actually got to create a system that doesn't tackle misinformation, but make sure that the right information is out there. And when you look at this Edelman report, you'll see that actually people only need to see information from a credible source 1 or 2 times to start to believe it. And having a personal connection with someone helps them believe it more. So if you've got a doctor and people still trust their individual doctor who's saying, I hear you. What are you really worried about? Let me see if I can help explain this for you. That rebuilds the trust. And I think it won't take long to rebuild that trust. But we do have to get our doctors to get off the whole trust me, I'm a doctor reflex. And there are still some that do that. There are also some that are really good and don't do that. But, this whole, you don't believe in that? Oh, for goodness sake, I'm a doctor. I've got degrees, I'm telling you. Terrible, terrible approach. But if we can get everybody being empathetic, listening to understand what the problems are, there's a great big group in the middle who are waiting to be persuaded one way or the other. And we have to try and persuade them with a whole of system kind of approach, which again, your question right up the top was really big one. I'm kind of answering it now, and the response, the answer is also going to be a really big one.
Well, yes, and it is, and all of those elements come into it. And I guess which brings me back then to the ivory tower and its perception is, over the period of time that it hasn't acted with empathy. It's thought its job is really only to speak to healthcare professionals, not to speak to everybody else. Does it now have to sort of change its tactic and go, well, hang on a second, because information is so freely available. And that's the other thing I want to is plain English summaries of studies, so people can't just pick it up and go, So this summary says this without everybody. They need to be understandable. But yes, it's time now for the ivory towers to start actually talking to real people and saying, we are your listening voice.
So yes, it is. And I think we're seeing that. I think we're seeing a lot of individual doctors now and professionals, Pauline Mackey, superstar, Professor Susan Davis, one of the founders of Gene Hales. She's now really active online. I think we're seeing individual doctors saying that. I don't know that it was necessarily that the ivory towers weren't listening. I think they were responding to a really outdated kind of approach where, our parents' generation probably went into the doctor and said, you've got the white coat. I trust you to tell me what the issue is. You don't need to explain anything. Just tell me what I need to do to be better. That was kind of what it was like, and that was kind of that societal expectation. And we still have older women, if you like, coming into our clinics who just tell me what I need to do. I don't want to debate it. I don't want to know. Just tell me what I want to do, what I need to do. So we've had the democratization of this health information has changed those expectations of how doctors particularly listen to us. Academics would never have dreamed that ordinary people would be reading their papers. Trust me, as an old academic researcher, we knew our grandmothers would listen and that would be it. Now people are trying to read primary papers, and that's a great thing, but they're not written for people without a basic level of understanding to follow, hence your point around the plain language summary. So I don't know that it was necessarily ivory towers. They weren't listening, but not for any sort of malicious reason or even arrogant reason. It's just
they didn't think that was their audience.
Now, I think we are seeing that social contract, I should say, is different between academia, medicine, and the people that we are serving. And some organisations have been slow to respond to that. And I look back and think, gosh, I really wish that we were out doing things on social media in a much more overt way, rather than having information sit passively on our website. We were a little late to that party. And I think most health information organisations were. And so we had consumers stepping into that breach, if you like. And then we saw these really entrepreneurial doctors who were looking to grow influence and for some, grow money stepping into that. And the rest of us are catching up.
Yep, absolutely.
Very long-winded way of saying I think I agree with you.
I admire your optimism. I'm not sure that I'm necessarily as optimistic as you are at this particular moment in time. But fingers crossed, because there does need to be some sort of form of just getting the right messages across to people, so they're not feeling that that they have been sold a pup, that they can actually trust what they're being told. I mean, not everybody gets it right all the time. We've seen that over the period, over history. But generally, most people in the health system I know are there for the right reasons.
Yeah,
with the evidence behind them.
Most of them are, by far and away. And I've been in medical and research circles for a very long time now, and 95+% are there for the right reasons. They're not always good communicators. There's definitely that, but they are there for the right reason. And I think, we talk about this effect on consumers. Can I just raise one other thing that I'm certainly seeing discussed here in Australia, and I'm sure it will be in the UK as well, that there's actually a real strain on the workforce, healthcare workforce, particularly in women's health, from what's called moral injury. So clinicians having women coming in and saying, I don't trust what you're telling me, or are you sure that should be, or no, I want that drug. And there's this medical misogyny and doctors aren't listening to women. And so many of the doctors are women who have lived experience, who went in for the right reason, and they're getting this barrage online of doctors are all terrible and they don't listen to women and that's moral injury for all these doctors who are out there doing the right thing and, working their guts out to do the right thing and keep across the literature. And it's really, really hard for some of these doctors. And I think we just need to be really focusing on the systems issues, errors, and actually, recognise doctors are people too. with motivation, like good motivation most of the time. And I really worry about what it's doing to the workforce, because they're the people who'll step out of the workforce.
Well, they are incredibly demoralised, and a lot of them, the GPs here, are,
Incredibly.
I mean, literally unbelievably demoralised. And I think,
Yes.
it's a difficult one, because what I hear, especially in comments, and I see in those community groups and things like that, is I'm preparing to go in and do battle with my GP.
Yes.
And you kind of think, oh God, wouldn't it be nice if you didn't have to do battle?
Yeah.
But I guess there are two sides of something. Well, there are many sides of it, but we have very short consultation times, people under incredible pressure and stress. Exactly what you're saying about the being told that you can't trust them, and there's medical misogyny. But hopefully, if everybody had really good education, then especially on menopause and things like that, we could get to the point much more quickly. I mean, we've just done a sexual health survey, and one of the things that came up in the end was, women's, you would have heard this a million times before, still being told to relax or fake it during painful sex and those kinds of things. But, good education would take that away.
But I'm going to come back to those cognitive biases, right? So when you look at that, so look at the Edelman report, and the person that people still trust is their doctor, okay? And then when we talk to women, most of the time, women will say, oh, those doctors, not listening. Or say, my doctor's great. My doctor's great. But I know all those other doctors. So I think there's a real confirmation bias going here. So someone has a bad experience with a doctor, and no, they're not all great. Some of them are just downright terrible. That's true. Has a bad experience, they share it, because we don't share the 99
we don't share good experiences
we have. And so what we see is this confirmation bias at play. You notice a story about a bad doctor because you had a bad experience, but you're not sort of thinking of or remembering those 99 great interactions you had. You're just stuck on the one bad because that tallies. It was wrong, it was bad, it shouldn't have happened, and so you notice it. And so online, we see all the horror stories about, pick a subject, doctor interactions, menopause, but people don't post about their great interactions. And so we're only seeing that little bit of convenient sampling piece going on, where we're seeing lots and lots of bad stories. So I again, back to that whole literacy thing, even surveys, like some of the ghastly surveys that have been done in menopause and the workplace and all these, where you just ask people to tell you about their bad experiences, essentially. And so then they say, oh, look, 97% of people said they had a terrible experience. Yeah, 97% of the 100 people you spoke to, not the millions out there. If we have an understanding of this, we can read something and go, yeah, well, but it could be that, and that. So I have huge empathy for people who say, I've had a terrible experience with my doctor. That's valid. I'm sure they did. We've got to be really careful not to think that that's, again, the universal experience, because there's so many great interactions and people just don't remember them because they're getting what they expect. So why would they brag about it, or why would they boast about it, or why would they talk about it? They're getting what they expect.
Yeah, absolutely. And even if you're on social media, all of the ones who do give their time, I mean, hundreds of NHS doctors and things who give their time to give really good evidence-based information.
Absolutely.
And they're tired, they're burnt out, and
yes,
really,
and they know they're going to get nasty comments online. Well, that's not what, and most people will read it and go, yeah, that tallies with my experience, and they move on without leaving a nasty comment.
Yeah, exactly. True. Well, speaking of leaving nasty comments, I think that we should probably end now before somebody leaves us these nasty comments. and I will let you get on with your day after I ruined your morning anyway. That was left of yours.
You did not.
Oh no, I ruined your evening, and then now
you did not.
Yeah.
Did not. It's fine. It's fine.
Yeah, just so people understand, I got my times wrong. Yeah. Yep.
It's great that you can admit when you're wrong. It's fine. It's good.
I often am. It's an ongoing process. So anyway, brilliant. Look, thank you so much for your time, and we should do this again.
I would love to. That'd be great.
Yeah.
Have a wonderful evening.
Thank you.